My name is Dr. Botla, and I'm a kidney doctor here at the Vascular Access Center. The purpose of this video is to describe the vein mapping procedure. A vein mapping study is necessary before a dialysis access can be created by the surgeon. This is done in anticipation of a patient needing hemodialysis. A vascular access is needed in order for hemodialysis to be performed. Hemodialysis is a treatment where blood is removed from your body, run through a dialysis machine, and then returned to your body. There are three different types of dialysis access: a catheter, a fistula, and a graft. A catheter is used as a last resort and is placed only when a functioning fistula or graft is not present. If a catheter is needed, it is placed in a large vein in the neck and then tunneled downwards where it finally exits in the upper chest. Catheters are not recommended for several reasons. There is a high risk of infection, a clot can form in the vein in which the catheter is placed, or the vein can narrow. A fistula is the ideal dialysis access. A fistula is created by a surgeon and can be done in either the forearm or the upper arm. During the operation, the surgeon takes a person's own native vein and attaches the vein to an artery. The vein, which is normally a low-pressure, low-flow vessel, eventually undergoes what is called a maturation process. Over several weeks, the vein matures into a high-pressure, high-flow vessel, otherwise called a fistula. The fistula is then used to remove blood from the body and ultimately to perform dialysis. Sometimes a person's veins are not suitable for creation of a fistula. In this instance, instead of a fistula, the surgeon will create a graft. A graft is a tubular structure usually made from synthetic material. One end is attached to the artery and the other end is attached to the vein. The graft can be placed in either the forearm or the upper arm. Grafts tend to clot more often than fistulas and usually do not last as long as fistulas. A vein mapping is necessary so that we can give the surgeon recommendations as to where the fistula should be placed. The purpose of the study is to map out your veins and arteries before the surgeon performs the operation. The chances of a successful fistula are much higher by having the vein mapping done. Many times when a fistula does not work, it is because the vein mapping was not done before the surgery. There are two parts to a vein mapping study. The first is the ultrasound portion. This is a non-invasive study where an ultrasound probe is used to examine the veins and arteries of the entire arm. During the study, the doctor assesses the veins and arteries to make certain that the vessels are large enough to use for creation of the fistula. Also, we want to make sure that the veins do not have any clot in them. The veins and arteries in both the forearm and the upper arm are visualized. The second part of the vein mapping is the venogram. In order to perform this portion of the study, IV access must be obtained. After an IV is placed in the hand, the patient is escorted to our procedure room. The patient lies flat on a table and we move our fluoroscopy machine into place. Contrast is then injected through the IV, and then pictures of the veins in the arm are taken under fluoroscopy. These pictures give the surgeon a broad view of the venous anatomy and allows us to visualize areas of narrowing which may not have been seen with the ultrasound. For those patients who are already receiving dialysis through a catheter, the contrast injection is not of concern. However, those patients who are not yet on dialysis may have some concerns about receiving contrast dye. You may have been told by your kidney doctor to avoid contrast. However, in this particular case, it should not be a major concern. The amount of contrast which is used in our procedure is a small and insignificant amount, usually between 15 to 20 milliliters. In fact, doctors have actually measured patients' kidney function after the venogram and found that their kidney function did not worsen. After the vein mapping is done, we will give you copies of both the ultrasound and the venogram. You should take these with you when you see the surgeon. Our access coordinator can even make an appointment with the surgeon before you leave our facility.